Praveen sir, is the screen visible?
Yes, Smrita ji.
Good afternoon, everyone. We'll start in 5 minutes. Kindly bear with us. Chinmay ma'am is just joining in 2 minutes. Praveen sir, can you please confirm again if the screen is visible?
Yes, it is visible.
Thank you. Praveen sir, can you please unmute the participants for 2 minutes?
Sure, it is done. Yeah.
Ji. Chinmay ma'am, can you please unmute your mic? Ji,
She has changed her name. Now you can see her name.
yeah.
Hello. Am I audible? Am I audible?
Yes, ma'am.
Thank you. Sorry, I was having some issues in joining. Thanks, Shweta. Thank you. Dr. Gohars, go ahead, right?
Yes.
Good afternoon, sir. Good afternoon, everyone.
Yeah, good afternoon, ma'am. Praveen sir, can we start the recording, please? Good afternoon, everyone. iTech India welcomes all the participants for today's National Distance Learning Seminar session. We are starting the dissemination of the National Guidelines for HIV Care and Treatment 2021 today. We have speakers from NACO, COE STM, Dr. S.K. Guha sir. From CDC India, we have Dr. Ramesh sir and Dr. Amit Harshana from iTech India. We also have with us Dr. Revari sir today. We welcome you all for today's session. Over to you, Chinmay ma'am.
Thank you. At the outset, I'd like to convey the best wishes of Dr. Puri. He could not join as he had to travel out suddenly. So very good afternoon, Dr. Gohar, Dr. Rewari, and all our experts and all participants who have joined today. So this is the start of the series of discussions we are going to have on the national guidelines for HIV care and treatment. So as you all are aware, we have recently released this document on the World AIDS Day 2021. And after the release, recently, a month ago, we have uploaded this on the website as there were a few changes to be made. So I hope you all are able to access it from NACO's website. And also this has been sent to all of the centers and to the states by email. So this document is going to be a ready reckoner for everyone who is associated with HIV care and treatment, and also for the private practitioners who are going to abide by the national guidelines if they have to. So this guideline, I mean, not only the program managers at the states, but also all staff of ART who are associated with the treatment component will definitely benefit out of this. In today's session, it's going to be an overview of the national guidelines and how this book has been, the document has been prepared. That overview will be taken up. So before Dr. Ramesh and Dr. Amit take us through this guidelines, we'll have Dr. Gohar's remarks. Here at the outset, I'd like to place on record our sincere thanks to Dr. Gohar, Dr. Rashikran, Dr. Rewari, and other experts from all the COEs and PCOEs, and also all our stakeholders. We had the SACS representatives, we had community representatives, we had all the partner agencies associated with care support and treatment in the development of these guidelines. And Dr. Amit has been associated with coordinating for ensuring that we have this guideline in place and on time. And Dr. Rashikran has really taken a lot of pain in development of this document. So here, when we start, again, I'd like to say that this guideline is going to give you details about what has changed in the last few years and how we can do a lot of things with respect to comorbidities. Because this guidelines for the first time is inclusive of opportunistic infection management and all comorbidities, as well as the pediatric section has been very elaborately discussed with inclusion of adolescent component also. So with this, we hope that in the next 1 hour, we'll learn a lot of things. So Dr. Gohar, sir, I'd like to invite you for your remarks, sir. Thank you.
Good afternoon, Dr. Chinmayi, Dr. Rewari, and all others. I'm missing Dr. Rajasekaran today. I think he was the driving force in bringing out this national guidelines for HIV care and treatment 2021. So under his guidance only, a very dedicated team of NACO and other partner organizations, they did a very commendable job, I would say, at the outset, and by bringing out an excellent and really up-to-date with scientific informations, the guidelines. And as Dr. Chinmayi was talking about, these guidelines deals with not only the antiretroviral therapy, adults, adolescents, it has got a separate pediatric section, and opportunistic infection guidelines, which was dated back 2007, has been updated with most of the recent informations and all global, incorporating all global guidelines. As well as there are the comorbidities, the non-infectious entities associated with HIV, all have been included. If we look back into the history of antiretroviral therapy in our country, this program was launched way back on 1st of April 2004 in 8 ART centers in high prevalence states and the national capital region. From there, we have scaled up at a very fast pace with establishment of more than around 640 ART centers and about more than 1,240 link ART centers. And there has been significant changes Dr. Chinmay was talking about in the recent times, starting from the test and treat all policy, and the routine viral load policy, and then DTG or dolutegravir transition, the advanced disease management package. All these things have come recently, which needed an updation. And probably some of these guidelines have been circulated through office memorandums of NACO, but compiling them into one book, which is, I take it very handy as well as very informative for all ART medical officers, the nodal officers, the other specialists working in this in the ambit of HIV care and support, as well as program managers as well working in the State AIDS Control Society or other DAPQ levels, etc. We also got support from the community of people living with HIV who have also contributed in this contribution of this guideline, development of this guideline. As we all know that HIV guideline is, HIV medicine is moving very fast. If you look into the global guidelines, the various American as well as European guidelines, everything, the guidelines are moving very fast. To keep pace with those development with knowledge and guidelines, it becomes necessary. It became necessary to come up with a newer one, this one, and regular updation could be done. I understand that was the one thing that has been that was proposed. I understand that there would be a small mobile version of it that is going to be launched by NACO very soon, and as I understand. And I would, in addition to Dr. Rajesh Sekran, whom I named at the outset, and some partner doctors from partner organization really did a very commendable job, like Dr. Ramesh, Dr. Amit, Dr. Raini, Dr. Manish, all of them, and Dr. Rewari and others, many others, I would say. I can't name all of them, but they did a really commendable job. So I look forward to this particular session that will be dealt with by Dr. Ramesh and Dr. Amit, Dr. Ramesh from CDC and Dr. Amit from ITEC, who are known to all of us. So with these few words, I would once again, I am sharing my feeling that I'm feeling elated. So with these few words, I go back to Dr. Chinmay. Over to you, Dr. Chinmay.
Yeah, thank you, sir. So I think I'll hand over to Dr. Ramesh and Dr. Amit to do the presentation. Thank you, sir.
Thank you, Chinmay ma'am, and thank you, Gohars sir. Dr. Amit sir, can we start with the session now?
Sure. Thank you. Good afternoon, all. Good afternoon, sir and ma'am. And I think it was a privilege for all of us to work under all the seniors, experts, and what a learning it was for all of us. Thanks for that. So next slide, please, Shweta. So as sir and ma'am has already mentioned, I mean, so in this today's session will be only talking about the overview of the guidelines. We'll be talking about how the spread of contents and the sections are, and we'll go through some of the details. And then this would be followed by a robust calendar of the technical sessions chapter-wise, which will be taken in the coming weeks. So as you can see on the screen, on the left side, which was released on 2018, and on the right side, which is the recent latest document which you have. And as Dr. Chinmay and Dr. Gohars has already mentioned, so this guideline has now the additions of the opportunistic infection management and also some of the non-communicable diseases components. So this has become a big and good reference document for all of us, for us to follow for coming years. Next slide, please. So the aim of the guidelines is to harmonize the treatment practices across the public and the private sectors, since these are patients who seek care from both the sectors at the same time or at the different points in time, and also to consolidate the various existing guidelines and incorporate recommendations as what Gohars was talking about. So all the recent recommendations to be incorporated for all the age groups, genders, and populations. So this has been taken care, and also provide these standardized guidelines for prevention, screening, diagnosis, and management of common opportunistic infections among PLHIV. Next, please. So in this guideline, as we have like talked about it, but again to reiterate, it's written based on the national recommendations that have been finalized based on the national and global experiences and recommendations to take care of, like, what is the country's context, and this has been taken into consideration, making sure that the availability of diagnostic and the treatment options which are present in the country. So looking at recommendations and also what is there important for the country context, that has been well thought through. Next slide, please. In the development of guidelines, as Saran ma'am has already elaborated on the all the different experts, those who had contributed in this, but formally, so this guidelines finalized based on the recommendations of the technical resource group for ART, comprising of the expert clinicians and medical practitioners from the public and private sector, also the technical experts, the experts from Government of India, consultants from WHO and other UN agencies, network of positive people and non-governmental organizations, NGOs involved in the care and treatment of PLHIV. Next slide, please. So these guidelines will continue to evolve as what Sir was mentioning. HIV medicine is quickly revolving around, and then we also need to learn from the recent recommendations and the global evidences. So these guidelines will continue to evolve and will be revised and updated on a regular basis as per the emerging national and global evidence and recommendations. Next slide, please. So in terms of distribution of contents, the whole guideline is divided into 5 sections, followed by a section on annexures. In section 1, it's a general section. Section 2 is talking about the adults and adolescents. Section 3 is about pediatric section, and then section 4, which is a new section talking about the management of opportunistic infections. And section 5 is about comorbidities, and we'll be seeing the details in subsequent slides. Next, please. So as mentioned before, these opportunistic infections and comorbidities are quite new, and this has been added. As Sir had mentioned, the opportunistic infection guidelines was written way back in 2007. So quite a big update in this particular section as per the guidelines. Next slide, please. So if you look at the content-wise, so what we are going to do in this today's short presentation, we'll talk about sections, and we'll also talk about some of the highlights or the additions or some of the revisions that have been done in the guidelines. And in the coming weeks and months, we'll be going through each and every chapter and the section in details. So the general section contains introduction and also a diagnosis of HIV infection in adults and children. Next, please. So the revisions or the additions, since we all know that HIV Act was a landmark decision, so definitely the inclusion of that, and also the declaration on SDGs to reach out to the common public health goal for 2030. So all those things have been added, and also wherever required, the data has been updated. So looking at the recent estimates, whichever is available, that has been updated in the guidelines. So as you can see on the right side, the National Summary of HIV/AIDS Epidemic in 2020. So this was a recent data that we have, which has been updated. Next slide, please. If you look at the content of section 2, which is about the adult and adolescents, this section contains 10 chapters. So starting with the assessment of adults and adolescents with HIV infection, then ART in adults and adolescents, and then also it was a thought through decision to bring the advanced disease management chapters here, because everything starts from the assessment period. So, and then adherence to ART, PPTCT, and ART in pregnant women, first line ART, and also including the management of toxicities. Then ART treatment failure in adult and adolescents, when and what to switch. Then the dedicated chapter on HIV and TB co-infection, case finding, management and prevention of tuberculosis. Then also prevention of opportunistic infections and post-exposure prophylaxis. And also something to mention here, because the HIV, let's say for example, HIV TB co-infection or advanced disease management, so or let's say infant ARV prophylaxis. So it has been taken care in the whole piece wherever there is a cross-referencing required. So that has been taken care. So when you're going through the guidelines, you would note that whenever there is a reference for or so for example, HIV TB has to be cross-referenced so many times. So that has been taken care, and you can very well go back and come forward, etc. Run through the guidelines, referring to wherever it is required. Next, please. So in section 2, now some of the new additions in chapter 1 and 2, which I mentioned just now. So, the introduction of the advanced disease management, including the warning signs, because that starts with the assessment, and some of the changes that has been done in the nutritional assessment section, along with the updation of the BMI chart, and the updation on the assessment and management of patients during the first and follow-up visits at the RT center, that has also been updated. Then we all know that the introduction of new ART, dolutegravir. So everywhere throughout the guidelines, this has been taken care wherever required. So introduction of DTG, any drug interactions of DTG, or the lab monitoring frequency that has to be updated, that has already been done. The first line and alternate ARV regimen guidance, including the DTG-based regimen. So all that has been taken care, and also the rapid ART initiation algorithm in PLHIV that has been added. Next slide, please. So these are some of the screenshots or the highlights which we will be seeing throughout the session. So on the left side you can see the addition of DTG. So a lot of tables you would find the reference of DTG now. And on the right side, what you're seeing is the rapid ART initiation algorithm. And when we go to the relevant chapters, we'll be talking in detail about the algorithm and the all the technicalities. Next slide, please. In this chapter 3 and 4, 5 combined. So as mentioned before, the whole new chapter of advanced disease management has been added, including the burden of advanced HIV disease and the package of advanced HIV disease management, and also some of the changes that recently has happened in the ART initiation in PLHIV co-infected with TB. So you would see those changes in the guidelines. And also a lot of effort on specifying the adherence barriers to the specific population groups, and accordingly the new checklist have been included in the guidelines, and some of the revised examples for adherence calculations. Then if you look at PPT CT strategies, including the 4-pronged strategies, you would find the reference there. And in terms of the infant prophylaxis, because the dual prophylaxis has been added in the guidelines, so you will find cross-referencing and also a beautiful document written clearly about the dual prophylaxis based on the risk status of the, and also some of the case scenarios on PPTCT, including the dual prophylaxis that has been updated. You will find a lot of cross case scenarios for you to easily understand and also see what decision can be taken at the field level. And the ART regimens in pregnant and breastfeeding women that has been added, considering that the inclusion of DTG-based regimens, and also including the decision tree for ART in pregnant and breastfeeding women with HIV, so that can act as a radio reckoner and for quick follow-up. Next slide, please. So in this, you can see some of the screenshots from the guidelines. On the left side, what you're seeing is the burden of advanced HIV disease. And on the left below, what you see is the trend of median CD4 count at the time of registration at the ERT center over the years. So, all the evidence, all the recent evidence to what we are talking about, so that all has been updated. On the right side, what you're seeing is all the components of the package of interventions for people for advanced HIV disease, starting from screening and diagnosis, prophylaxis, and ART initiation, and so on. So everything is given in a beautiful tabular form and also in the flow diagrams, which can be referred as and when required. Next slide, please. Similarly, so you'll find some of the references which are the recent updates. On the left side, you can see the timing of ART in relation to the initiation of TB treatment, because that has been updated. You'll find the reference of that in the guidelines. On left below, what you see is the preferred ART regimen for pregnant or breastfeeding women with HIV. So talking about the DTG-based regimens. And on the right side is the table on the ARV prophylaxis, including the dual prophylaxis and the HIV risk status, low risk and high risk infants. So all this, as a quick snapshot, we want to share. Next slide, please. In chapter 6 and 7, in view of the new additions of DTG-based regimens, so all those tables have been updated, and also the common ARV toxicities, including the DTG-related toxicities that has been added, the algorithm for patients starting with the ART regimen now, because with cotrimoxazole prophylaxis, when we talk about rashes development, what to do. So that also you would find the reference of DTG-based regimens for you to take easy decisions. Then all the second line and third line regimens have been revised, considering all the new additions of regimens, and also the management of side effects related to that has been updated as well. Revise the targeted to routine viral load. This is has been done, and also wherever required in terms of the association in terms of HIV TB in second line or third line ART patients. So all you will find in the guidelines now. Next slide, please. So on the left side, what you're seeing is the comprehensive second line ART regimen. So, as a radio reckoner, you can always refer this, wherein, those who are failing first line and what regimens, and then what decision you have to take for the second line ART regimens. That has been clearly spelled out. And on the right side, what you're seeing is the third line ART regimens, meaning when you have the scenarios and so beautifully captured in the tabular format, so that it can be easily referred and helpful for easy decisions making. Next slide, please. In this chapter 8, which is the dedicated chapter for HIV TB, so you will find a lot of material, and also you'll find a lot of cross-referencing in the whole guideline. So because TB is the most common voice, so definitely has to be given due importance. So the whole chapter is talking about understanding TB, HIV associated TB, including management of CLHIV, and then prevention of TB, TPT, whatever are the new recommendations or the guidelines are there as per the TRG and NACO. So that has been updated in the guidelines, and the revised drug-sensitive TB algorithm has been updated. Consideration in PLHIV, those who are already on ART at the time of diagnosis of active TB, and also at the same time, management recommendations for TB diagnosed in patients already receiving ART. And also there's a new dedicated chapter you will find here in the TB chapter, which is about management of drug-resistant TB in PLHIV. All the algorithm for DRTB has been updated, and also a dedicated section on management of HIV TB co-infection in a specific situation. So you will find all the tables for your easy reference in this particular chapter. Next slide, please. So sorry for the cluttering. So just quickly showing as what I was mentioning. So on the right side. On the left side, what you're seeing is the integrated drug-resistant TB algorithm based on the PMGT guidelines. And then in the middle two boxes, what you're seeing is the diagnostic algorithm of TB in CLHIV, and the middle below, what you're seeing is recommended approach to TB diagnosis in PLHIV. on the extreme right, on the top, what you're seeing is algorithmic approach to diagnosis of DRTB in children. And on the below, you're seeing clinical manifestations in CLHIV, both in pulmonary TB versus extrapulmonary TB. So giving the snapshots in terms of showing that, this is something which can be easily referred, because all the algorithms, all the flow diagrams are beautifully captured here, and which can be used for easy reference. Next slide, please. In the last part of section 2, which is chapter 9 and 10, the whole new chapter on prevention of opportunistic infections, detailing the primary and secondary prophylaxis wherever required or recommended, and the drug of choice for the prevention of common opportunistic infections. All that has been updated. A good chapter or section on the TB prevention therapy. All the scenarios have been updated with the recent IPT recommendations. So wherever there are contraindications on IPT, all those things have been updated. In chapter 10, which is about post-exposure prophylaxis, wherever there is a update on the recent guidance in terms of the percentages of revised activities associated with needle stick or sharp object injury, or a revised, and there's also a revised figure, or let's say table on the devices associated with percutaneous injury. So all that with the recent evidence has been updated, and also the PEP regimen, which has been revised with the latest recommendations and the addition of dolutegravir in the regimen tables. Next slide, please. So with this, I'll hand over to Dr. Ramesh, and he will take us through the rest of the sections from here. Over to you, Dr. Ramesh. Thank you.
Yeah, thank you, Dr. Amit. Yes, this guideline, actually we had separate guidelines for pediatrics as we see in the national program. So now this pediatric portion of the guideline is also part of this entire guideline. And section 3 of this guideline actually talks mostly on pediatric related formulations or opportunistic infections, giving a link from here. So we have around 7 chapters in the pediatric section of the guideline, and which run from 3.1 to 3.7, where now we, next slide please. Yes, so you see the inclusion that we have in this guideline is on management of adolescents with HIV, which we are, there's a separate section, and all the pediatricians felt that this is very necessary now with most of the adolescent care. And we also have the advanced disease management for children. And opportunistic infections in CLHIV we have here. And this again, as Dr. Amit was discussing, we have been linking most of this to their respective chapters. For example, if you have something related to respiratory system in child, so when you read about the opportunistic infections there, we have referenced about how to manage children in the same chapter. And we have some common comorbidities in children, and palliative care in children again is integrated in section 5, and HIV/TB in children is also integrated in 2 parts, that is near HIV prevention and also section 2.8 we have. So once you start reading the guidance, and this becomes very important for you to understand how to cross-refer to each of the chapters. And for example, if you take something on child IPT, you will not find exclusively there, but you will have to refer back to others, and it is clearly given. So that is how the writing committee has ensured that we do not miss any information, or we do not repeat most information, but rather give a cross-referencing across. Next slide, please. Right. In the chapter 1 and 2 that we see in pediatrics, it is mostly on management of HIV-exposed infants and children, and newly diagnosed HIV in children, including ART initiation. So in these 2 chapters, the background of the management of HIV-exposed infants and children is completely rewritten here, and you will have real examples from our ART centers, where most of our pediatric writing group have introduced some of the examples from their own centers. And infant dual prophylaxis is part of the guideline now. So that again is described very clearly with good illustrations and examples. Immunization update, you will see the management of newly diagnosed infection in children, including ART. So this is our second chapter, wherein we have included the follow-up of children after ART initiation. And then we added the rationale for using dolutegravir and the modified flow chart for choice of ART regimen in children. So these are all the revisions that you will be seeing in section in chapter 1 and 2. Next slide, please. These are some good snapshots from the same guideline. On the extreme left panel, we have the vaccine dosing and what are the recommended vaccines with some good data to support from the national program, why and why not, and the timing of each of these. Then we also have the clinical criteria for presumptive diagnosis. And very carefully, if you read through the notes that are being given at the bottom of each of these tables, they will actually give you certain very good examples from the site. Suppose you come with a patient who doesn't have parents, what to do in this case. So there are certain very specific examples and prompts given in each of these tables, and those updates are again provided within these guidelines too. Next slide. In chapter 2 and 3, some of the revisions that we have again are for how do we manage children with rifampicin-based ATT. Then pediatric dose chart has been added as an annexure here. So this again is a very good tool that we can use, and please do look into these and could take a printout of this specific annexure and have it on your tables, which again is a very updated dosing chart that we have included. And ART in special situations, mostly in HIV/TB co-infection, and advanced disease management for children less than 5 years of age is a complete new addition to our guidelines. Next slide, please. Right. So on the extreme right is the algorithm for assessing children for advanced disease management, and we have within that for children, what are those specific things that we need to provide as part of the package of advanced disease management, and the age and weight band wise recommendations for the first line management within children. So these are all given very neatly, and as Dr. Guha rightly said at the beginning, we have most of these in the form of OMs and all, but everything now culminated into one guidance which we could refer easily. Next slide. Together with all chapters 4, 5, and 6, some very important things that we have included is the revised viral load testing algorithm, and we have also included some of the guidance related to PPTCT here, where you need to get an extra viral load. And then we have included third line ART regimens in children. And we have modified the malnutrition and HIV chapter, wherein the figures are modified from the previous version of the guidelines. And figures on depicting the growth chart in different situations, again, we have brought it instead of an annexure, we have included within the chapter itself the different growth charts and how do we interpret them. Next slide. So again, here the definitions of virological failure, and we see the different second line regimens which are available within the national program for children, and the third line regimes. So very detailed, and any deviations or any other dose recommendations, all are given very neatly in the form of asterisks below the tables. And what is in the table is, again, we have ensured that there is consistency across adults and children and adolescents. So weight bands, everything are structured well here. Next slide. Section 7, which talks of counseling for children and adolescent. So the adolescent component again is included here. This for specifically looking into the counseling issues from vertical transmission, and when the people, when the children are again transitioning to adolescence, what are the type of counseling issues and some case scenarios related to that are provided. Next slide. Right. So again, the chapter number 3.6, which we've included on the nutritional care of HIV infected children, and how do you grade malnutrition within an ART center by the counselor. So simple steps for that, and medical officers, how do we refer these cases. So pretty much we have also, the writing committee has also touched upon how best to guide the ART center staff on assessing the nutritional status of the children, which again is very important for further referral and also for monitoring the treatment outcome. Next slide. The section 4 is again talks of the opportunistic infections, most common opportunistic infections. And this again, we had a separate guideline for this, which now it is subsumed into the same national guidelines for HIV care and treatment within the same thing. So when you open chapter 4, that means you are dealing mostly with all opportunistic infections. And this again, we have chapterized based on the system, that is central nervous system, respiratory, gastrointestinal, skin, and mucous membranes. Next slide. So in the chapter 1, that is in the introduction part, we have updated the latest information in terms, because earlier, if you see, there is no much data that we have. What are the types of OIs that we have in Indian context? And so there was a good literature review that was done by the committee members, and so we have tried to provide what is that average number of OIs that we see across reported from within country. So this again is a good resource to look into what are the types of opportunistic infections we have, and the data update on that. And common diagnostic and treatment related challenges have been included under each of these chapters, and operational flow for screening and management of cryptococcal meningitis. So there are flowcharts included for cryptococcal meningitis and other respiratory infections too. And wherever we, within these chapters, the pediatric component in terms of management of each of these OI is pretty much in detail we try to provide. And the laboratory diagnosis for each of these OI is also dealt in much detail. I mean, what are those screening tests? What are the confirmatory tests we have? And how to make a good clinical decision based on these investigations is provided for each of these opportunistic infections. Next slide. Yeah, so the panel that you see on my left, that is figure 4.11 and 4.13. The first one talks of what are the common opportunistic infections. And again, the proportion of symptoms presenting signs and symptoms. These, if you remember, we had pretty much old slides on this. So these are some of the things that we could use while we train our staff or within districts when we are training. So this is something most updated that we have now. And the flow charts for the decision making for cryptococcal meningitis and for other major opportunistic infections, we have given the decision tree, how better the counseling can happen, and then the staff nurse and how the medical officer could navigate the patient for treatment or for referral to other services. So pretty much detailed these flowcharts or algorithms have been developed, and these can be used as a very standard practice so that we do not any patient for miss any patient while referring, and how better to document within our system. Next slide. In chapter 3 that we see mostly is chapter 4.3 is on the respiratory system. So here again, for every opportunistic infection, we have given what is the disease burden within our country, and if there are any variations within the country, even those have been clearly spelled out. And mainly the other pathogens with pulmonary manifestations like histoplasmosis, nocardia, aspergillosis have also been included here. And COVID-19, as we know, is ongoing. So there is a particular section that we have included, how best to tackle this within a PLHIV and what are the recommendations that we have for vaccination and how frequently. So all these are dealt with the current evidence that we have. And as Dr. Chinmaya had told in her opening remarks, yes, this will require a continuous updation process, and the chairmanship of NACO, this will keep updating, and we will get the updates. Next slide. So this slide, you see how nicely there is a depiction of multiple systems involved in COVID-19 and what are some of the recommendations within PLHIV. So this is how we have clearly laid down pictorially, and many illustrations you'll be finding in each of these chapters. Next slide. And in chapter 4 and 5, chapter 4 deals with gastrointestinal system, and chapter 5 in opportunistic infections is skin and mucous membrane. So this again, we have included many picture depictions of the lesions with very high resolution images. Next slide. Yeah, you see, for example, one is you see the molluscum contagiosum or the oral hairy leukoplakia. And we also see the diarrhea chapter, actually it covered very extensively and with good flow charts to how better to plan the management of patient presenting with diarrhea. Next slide. With this move, we move to the last section of the guideline is on comorbidities. If you look at, we have put tuberculosis actually under section 2, because mainly there is more of ART there and tuberculosis treatment. So that's how the chapter on TB, you will find it under section 2 in section 2 and 8 chapter. But all others like the non-communicable diseases, the hepatitis, leishmania, again, we have considered it, though it is present only in pockets within the country, this again becomes a very important comorbidity. And then management of sexually transmitted infections is introduced again here at length. And common comorbidities in children with HIV and malignancies, how best to refer within the system we have it within the national program, and a palliative care for adults and children. So these are the 7 chapters again that we have under comorbidities. Next slide, please. So for the non-communicable disease chapter, we have included the health promotion as one of the key intervention strategy, and how best we manage for hypertension screening and diagnosis within the ART centers, how much it's possible, and when do we actually refer the patients. And screening of common cancers and related referrals among PLHIV is also provided. And for hepatitis co-infection, we have dealt about how do we have the referral mechanisms between the NBHCP and with NACP program, and the hepatitis C screening availability in the program and the management strategies. Next slide. Right. For example, on the left, what we are seeing is how do you screen and diagnose somebody with hypertension, then with diabetes. So these are all very clearly given step-by-step process. And the referral mechanisms are also, I mean, when actually the triggers for referral, when do you refer the patient? So these are also provided as part of the guidance. Next slide. This is on hepatitis B co-infection. You see on the right, what are the different management strategies? When do you put a patient on C treatment, and what are the diagnostic tests required for this? So pretty much elaborate stepwise illustrations are provided. 3 and 4 again is on chapter on HIV and leishmaniasis. This is included a de novo chapter we have now. And management of STIs. Several experts again have provided their inputs in writing up this chapter so that at least the basic STIs are screened properly even at an ART center and we do not miss them. So this chapter again has good pictorial depictions and also illustrations for us.
Sorry to interrupt you, sir. Audio is not clear. Can you please adjust your microphone?
Okay. Now is it okay? Hello?
No, sir.
Can't hear?
No, sir. It's quite low.
Is it okay now?
Can you try? Oh, no, can you try without the microphone, sir?
Now is it okay?
Oh, yes, sir. We'll continue, sir. Thank you.
Next slide, please. Yeah, so this is again an illustration of visceral leishmaniasis that we have included, and when do we refer, and the different age bands are given here. Next slide. And again, we have the 5th and 6th chapters on comorbidities in children and guidelines for the management of HIV-associated malignancies. And here, most of the malignancies we have touched upon with clear indications of referral and what are the current staging practices that we have for each of these malignancies. Next slide. As examples, we see here common comorbidities in children and HIV-associated lymphomas and other malignancies that we see most common. Next slide. Chapter 7 is mainly on the palliative care. Amit, can you take over? Otherwise, the voice is not clear. Amit?
So please give me 2 minutes. I'll just check.
Are you able to
I
hear
think
now?
there's some. Yeah, we can hear you, sir.
Okay. Next slide.
Yeah.
Right. So mostly we have retained in the palliative care chapter. The addition that we have now is in children, how do we manage this? Because the earlier guideline, I think we didn't have much on children and palliative care, but in this guideline, we have incorporated most of the palliative care in children. Next slide. And almost 20 annexes we have, and these are all very useful annexes, like starting from EID algorithm to pediatric ARV dosing and all other pediatric weight for age chart. Next slide. Right, for cotrimoxazole, amphotericin B, and IMNCA guidelines for feeding recommendations for children. So there are so many tools that have been included, and you can use them as a ready reckoner or stick upon your table so that they'll be very useful while we manage patients coming to our ART center. Next slide. Yeah. So,
So sorry to interrupt. So sorry to interrupt. There's again some disturbance.
Is Dr. Amit available?
I'll just
No?
check, sir.
Yeah.
I think, sir, audio is better now. Can you please try now?
Yeah. How is it?
Yes, it is. It is fine.
It's fine now?
Yes, yes, sir. Yes, sir. Please carry on.
Okay. Okay. So in chapter 1 that we have in the guidelines, it's mostly to introduce about what is the scenario of HIV within the country and what are the key milestones that we have. Next slide. Next slide, please. Yeah. So in this chapter, we see the evolution of the National AIDS Control Program from phase 1, phase 2, phase 3, and phase 4. What all has happened, like Dr. Gohars introduced in the initial remarks, that we had our National AIDS Control Program initiating antiretroviral therapy somewhere in phase 2. Then we have a rapid scale up of all antiretroviral therapy. Similarly, all other components of the national program have evolved. From the time HIV diagnosis was first diagnosed in 1986, since then there is more and more evolution of the National AIDS Control Program, number one. Number two, there is also many other scientific science has evolved very rapidly in the last 2 decades that we are looking for HIV prevention, care and treatment. Next slide. Look at the epidemiology, like the first ever case, as we know, it was in 1981. And then the recent estimates that we have, around 27 million people are accessing antiretroviral therapy. And in India, we have around 2.1 million patients living with HIV. Within our ART centers, we almost have 1.4 million patients taking antiretroviral therapy, or who are taking antiretroviral therapy from almost around 640 ART centers in our country. Next slide. So if you look at the age and number of people living with HIV, we see that within the age band of 15 to 49 years, almost around 0.22% contribute to this age group. And AIDS-related deaths, we see a decreasing trend in India, and mostly this is attributed to increased coverage of antiretroviral therapy. Next slide. Next slide, please. Yeah. So this is our data. We see that Mizoram is the state with highest adult HIV prevalence, and 0.22 is our national prevalence of HIV. And we see mostly in the northeastern states like Mizoram, Nagaland, and Manipur, which contribute to a very high prevalence. And then in the south, we have Andhra Pradesh, Telangana, and Karnataka. So this is again to say that we are dealing with states where we are seeing, number one, emerging epidemics, not just saying that all the states that we were saying earlier, but now we are seeing some emerging states like UP, Bihar, and all. Still we have our epidemics going on. That means what we need to anticipate is that we should be actually getting more number of patients, or if we are getting patients at a very later stage. For example, we have seen in one slide, the median CD4 count again is somewhere still around 220 or so. That means people are actually reaching late. So certain efforts from our side, we need to provide to the national program. Next slide. So again, tracking back to the history of HIV in India, we see the first case in Tamil Nadu. Keep moving, yeah. And then approximately, as I was telling you, our ART initiative started in 2004. And then in 2006, 5.6 million cases of HIV existed in the country. Next slide. And we also see that there's a launch of free ART and how the treatment has increased from 8 sites to 620 sites now in the country, with 1.4 million PLHIV on antiretroviral therapy. Next slide. So now PLHIV have a direct access to free diagnostic facilities, first-line therapy, PMTCT or PPTCT, opportunistic infection screening, single window services for TB. So these are all some of the interventions that the National AIDS Control Program has been undertaking. And there is more and more evolution and innovations that the program has brought in. Next slide. The innovations in terms of multi-month dispensation and being patient-centric and client-centric approach. And this is all to reach our target by 2030 to end of AIDS as a public health threat. So that should be our single objective, is that why we do all this is to ensure that people stay virally suppressed and there is no transmission of HIV, and we ensure that all patients who are on antiretroviral therapy remain on ART for lifelong. Next slide. Yeah. Thank you very much for your patient listening. If there are any questions.
Thank you so much, sir. Participants can now unmute their mics if they have any questions. Please feel free to type your questions in the chat box as well. So I don't think there are any questions.
Sure. Yeah. Thank you.
Yeah, thank you so much, sir. Thank you everyone for joining the session. The next session is planned on 30th June. That's Thursday from 2 to 3:30 p.m. Thank you, everyone. We'll close the session now. And sorry for the audio problem.